about your first aid kits is that you should know how to use everything that's in it. So if there's going to be things in my kits that if you don't know how to use it, it's not going to do you any good. So don't worry about putting it in your kit. But if you do, these are some nice things to have. I keep mine just in a regular backpack. All of my stuff fits in here. I've taken it all out just so it's easier for me to get to and find. But this is what I usually keep my stuff in, so it's easy on the go, throw it in the car, whatever. First thing I'll show you is all the tools that I keep in mine. I keep different types of scissors. These are like bandage scissors. I keep very sharp pointed scissors. I've got my tweezers. This one has, I don't know if you can see it, a flat end on this side and a very almost kind of pointy side. Well, pointy side on this side and the flat side on that side. So I can use it for a couple of different things. I also, these kind of work like scissors. These are called hemostats, but they clip in place. You can find these online. I took them from a kit when I was working at the hospital because they throw these away, but I grabbed onto them. Works really great to get hooks out of fish mouths if you're a fisherman. I also keep a thermometer in mine. I keep a very large syringe. This is for irrigating out wounds. So if you have somebody that's got a cut and it needs cleaned out, this works really well to just get a little bit of soapy water and squirt it into the wound and get it nice and cleaned out. I also keep a Sharpie. The reason that I keep a Sharpie is because if you have somebody that has an infection, you want to keep track of that infection and see if it's getting better or worse. So what you can do with the Sharpie is you can draw a border around the edges of where the redness is. And if the redness expands out past that border, then you know that the infection is spreading, or if it starts to kind of shrink down, you can tell that the infection is getting better. I also keep my stethoscope and blood pressure cuff. I keep an ophthalmoscope. One thing that you might want to use instead of this is just a flashlight. This does have a flashlight in it, so I don't keep a separate flashlight. I also keep a glucose monitor. Nobody in my family is a diabetic, but sometimes people are running low just because they've used all their energy, and so it's kind of nice to be able to keep track of that. If you are a diabetic, absolutely keep a spare one of these in your first aid kit. I also, in one of my other sections, have some nail clippers that have a little nail file on them, and those are nice to have for all sorts of things. I keep this in the main pocket of my bag. It has lots of little pockets. I just picked this up at the hardware store. It's double-sided, so I have lots of space to put all my miscellaneous things. One side I have completely dedicated to medicines. A couple of these are prescription, but most of them you can get just over the counter, and I would recommend keeping a lot of these in your first aid kit. And I'll show you how I keep them. So I have a whole bunch of these just little bottles, and they have little red caps on them. My pharmacist husband snagged these from somewhere. I'll have to ask him where he got them from because I'm not sure, but they work really well. And I just write the name on it. This one happens to be Tylenol. And I keep lots of these little bottles in there. So save space, but I can keep about 10 pills in each one of these. I keep ibuprofen, Aleve, Tylenol. Ibuprofen and Aleve both work great for pain, fever, and inflammation. Tylenol is good for pain and fever. If you have severe pain, it works really well to alternate ibuprofen and Tylenol together. They can be taken at the same time. They work with different mechanisms. I also keep eye drops in my kit. I keep anti-diarrheal pills for obvious reasons. I keep an inhaler couple of people in my family have a little touch of asthma. It's really nice to keep the inhaler on hand. I keep some anti-nausea medication. And another thing when you're looking at getting some of these is buy the generics. You do not need to spend a lot of money. You can usually pick these up for a couple of bucks with the store generic brands. I also keep antibiotic ointment, antifungal ointment. I like to keep some lip balm in because you never know when you're gonna need some of that. I also keep a little bottle of Johnson & Johnson's head to toe in my kit. And the reason that I keep this in is because it's a very gentle soap. This works great to clean out any wounds or cuts that you have. Just mix this with a little bit of warm water, pull it up in your irrigation syringe and just wash the wound. It works fantastic. And then I also keep a little tube of either vitamin A and D ointment or Vaseline. So that's my medication section. I can get it back together. On my other side, I keep some of my wound care stuff. So I have my hand sanitizer over here. I do keep a big pack of gloves just for protection. I've got a whole bunch of them. I like to keep steri strips. And the reason that I really like steri strips is they work really well to close most decent sized cuts. My kids are constantly injuring themselves, and I don't take them to the doctor for stitches super often. We often try to steri strip them before we'll take them in. But in an emergency situation, these are really awesome to have. I do also keep some suture thread with a needle on it. In the event of a big accident where we're not going to get medical care for maybe days on end, I do have this if I needed to suture somebody together. If you wanted to keep something like this, you probably don't have access to sutures, but you could keep just needle and thread. Works great. Just make sure that you submerge it in alcohol and get it really clean before attempting to sew somebody up. I also keep liquid bandage in here. It works really great, especially if you have like some chafing or something going on. You can put this on and it'll protect the area. I have all sorts of miscellaneous Band-Aids, Q-tips, and lots of tape. I love tape. Tape is so versatile. You can use it for all kinds of stuff. I actually have more just tape and gauze than I do Band-Aids, because if I have tape and gauze, I can make every type of Band-Aid. So that's what I keep. That's mostly it for this side of my kit. Oh, I do keep, I wanted to show you guys this, super glue. Super glue works really well on some smaller cuts. You know, doctors use the skin glue at the hospital all the time. Super glue works just as well, in my opinion. It does sting a little bit more, but it works really well to keep some of those smaller cuts closed. Some of the bigger things that don't fit in there that I keep a lot of gauze. These are my 4x4s. I've got my 2x2 gauze. I've got gauze rolls. I go a little overboard on the gauze. Like I said, I can make a lot of things with the gauze. I keep some very large bandages for bigger things. And a couple of miscellaneous things that I keep in my pack. I keep electrolyte powder. This is really nice to have for people that are dehydrated to help replace some of their electrolytes. This brand happens to be Vitalite. There's a million of them that you could use. I don't love Gatorade because it's super high in sugar, but Gatorade would also work. I keep Coban wrap in there. A note on Coban wrap. A lot of times if you go to the drugstore, it's really expensive. It's like $5 or $6 a roll. If you go to IFA and look in the horse section, they use this for horse wraps on the horse's legs, and you can get a roll. So look there if you're looking for some Coban. I also keep hydrogen peroxide. Hydrogen peroxide works really well on some smaller scrapes, bumps to clean them out and prevent infection. One thing about hydrogen peroxide is that not only does it kill the germs, but it also kills your good cells. So don't use this on anything super large if you can avoid it. I keep a bottle of alcohol. Alcohol can also be used to clean cuts. It stings really bad. I mean, hydrogen peroxide does too, but alcohol's worse. I use this mostly to clean my tools and instruments, soak something in if I needed before I put it on somebody. I keep some aloe vera gel for sunburns. Saline works pretty well to clean stuff out. One thing that I keep in my kit that a lot of people don't think of is this is just a top sheet. It's wrapped in a Ziploc bag. And the reason that I keep a top sheet is because I can cut this into any bandage that I want. I can cut this into a triangle bandage. I can cut this into strips. I can use this to roll somebody onto it and drag them to a safe place. Super, super easy to just keep a top sheet. My kids hate top sheets anyways, so I have tons of fitted sheets with miscellaneous top sheets. So I just stuck one in my kit. I think that's about it for my first aid kit. Does anybody have any questions about what I have in there or what it's used for before I move on?
I have a question.
Yeah.
Is there a concern about dates on medicine and, expiration dates? Sometimes I think we're a little overzealous when some of these things can go more than a year in the kits and stuff.
Yeah, for sure. So I kind of mentioned a little bit earlier, my husband is a pharmacist. He thinks expiration dates are a little bit silly because they are super, super conservative. The reason that most drugs have expiration dates is because they're either not tested out that far or they do lose a little bit of potency. So your ibuprofen that's 10 years old in your kit might not work quite as well as the stuff that you bought yesterday, but most of the time it will still work. It's better than nothing. But it is good to check the medications and roll them over. But if you're like a year over, I wouldn't stress it.
Samantha, I have a question about where you keep your kit. You said you can throw it in your car, but where do you keep it on like today? Where's your...
So I usually keep it on a shelf on my bathroom counter. Just that's where it fits in my house, but it can go anywhere. I do like to take this on trips because I do keep a smaller first aid kit in my car, but I don't keep like the big one. And a lot of the times when we go on trips, we're like whitewater rafting or mountain biking or hiking in Moab. And we've had accidents on some of our camping trips. So it's nice to have.
Question for you, Curtis Christensen.
Yeah, Curtis.
I know I'm a diabetic, but I'm a diabetic too. Question is, how do you store insulin or keep insulin in that first aid kit?
That's a good question. So insulin is a little bit tricky because insulin needs to be refrigerated. And if it's not refrigerated, then the proteins in it will break down and not be effective. So definitely keep the insulin in your refrigerator and then remember, like have a checklist or something, or just try to remember if there's an emergency situation and you have to leave or your power goes out, to try to get something cold into a cooler with that insulin and take it with you.
What you're saying then is it's safe to put it in, let's say a food carrier that has ice in it and things like that?
Yeah, as long as the water's not going to get into the insulin. If you have like a sealed insulin pen, I'd put it in a Ziploc, stick it in the cooler. Yeah. Another thing about medications is you definitely want to keep any prescription medications that you have in your kits. Obviously, I'm not going to be able to go over everybody's medications, but it is nice to keep maybe a little tube of just some of your prescription medications on hand for the event that you might only have that kit. So next, I'm going to move on to wound care. I think wound care is one of the main things that happens in an emergency, is that somebody gets a cut or a deep scrape or something that needs to be bandaged. So I think the first steps to wound care is you have to make sure that the wound is clean before you do anything. You do not want it to get infected. And then once you've kind of got it cleaned off a little bit, you want to make sure that there's no foreign bodies in it, meaning that like there's no sand or gravel or glass or whatever stuck in that wound. If it's a bigger wound, you may want to put pressure on it to begin with to stop the bleeding before you can get a good look at what's actually going on underneath. So you want to hold that pressure till you can get the bleeding slowed, and then you can then lift the gauze or clean cloth or whatever that you have on it and take a good look at it. Any big deep cuts, I would definitely recommend kind of my Johnson & Johnson soap with the irrigation to wash that out. When you do that, it's going to start bleeding again a little bit, and that's okay. When wounds are bleeding, it actually helps get all of the bacteria stuff that was introduced into that wound out. So, as long as they're not like bleeding out, a little bit of blood is fine while you're trying to get it cleaned out and get it clean. The next step is if you need to close the wound, if it's deep enough that it needs maybe some stitches or to be steri-stripped, you want to get the sides of the wounds as close to each other as you can. Wounds heal, like if this is a wound and this is the bottom of the wound, wounds heal from the bottom up. And so if it's left open, it takes a really long time to heal, and it also scars worse. So if you can get the sides of the wound together, then it can heal from the two sides together, and it can heal like within a week sometimes to get that completely better, versus if it's open, sometimes it can take months. So if you can get the sides of the wound together to help that heal. If you can't get to the hospital, then you may have to look at maybe stitching it or steri-stripping it or gluing it, whatever you've got. The next step would be to apply an antibacterial ointment. You want to create a little bit of a wet barrier that will keep bacteria from entering into that wound. And then after you've got the ointment, you want to put on, you want to cover it. You want to put some gauze, some tape over it, keep it covered. A little bit of air can be your friend, but you don't want it to dry all the way out. So it can be nice to open it up to the air, let it air out for an hour or so a day, put a clean bandage on it and let that heal. When you're looking at wounds after you've taken care of them, there's a couple things that you want to watch for. You want to watch for infection. You want to make sure that you're keeping it as clean as possible to prevent an infection. A lot of times when you have a big wound, people don't like to see pink. Pink is actually a very good thing. Pink means that blood is getting to the area and that healing process is happening. What you don't want to see is red, super, super angry, bright red. And a lot of people have a hard time kind of telling the difference, but pink's good. Like red, like a sunburn, like really, really angry, bright red sunburn, that would be bad. Another way that you can tell if a wound is infected is put your hand on it, feel it. Wounds that are infected will feel very hot. It will feel like there's a fever in that area of the skin, and that's another way to tell that it's infected. That's my kind of big spiel on wound care. Anybody have any questions about wounds?
One question I want to direct to you. A lot of the antibacterial ointments do have a pain reliever. I've noticed because I use them quite a bit.
Sure.
That's okay to put in your kit and use too, isn't it, to help with that pain?
Yeah, you don't want to put it in the cut, but kind of around the area or over the top of a closed cut would be fine.
Thank you.
Yeah. One thing that I did want to show you guys that I kind of had requested is how to do a finger band-aid if you don't have a finger band-aid. So get out a couple of my things here. These are just some little 2x2 gauze. I would, on a finger, cut this smaller. So I'll get my scissors. Just cut this into fourths. I asked my son to come be my model. He was not interested. So just get the little version. And then I've got, this is silk tape. Silk tape is one of my favorites, but paper tape works, clear tape works, any kind of medical tape works really well. You can just pull it like that. And then you want to strip the sides. So pull it down, not all the way, because you want to leave a space in the middle. Pull this down like that. And then you take your little gauze, put that right in the middle. And then you can put that on a finger like this and wrap it down, down, and up, and up. And then you have a finger band-aid that stays on pretty well. That's part of the reason I don't keep a ton of band-aids in mine. My kids think that band-aids are stickers. And so tape and gauze is not as fun. So I just usually keep the tape and gauze. The next thing I want to talk about was burns. So burns can be a little bit tricky because there's obviously the different stages of burns, ranging from a little bit pink to the skin's completely burnt off. So your stage 1 burns are pink skin, but the skin is still intact. The stage 2 is you've got blisters, and you may have a little bit of the top layer of skin come off. Stage 3 burns are you've burned all the way through the skin and you're now to the muscle layer. The first thing to do for somebody that has a burn is to make sure you cool the burn down. You want to use cool, but not cold water. Cold water can do more damage, but you want to use cool water to bring the heat out of the wound. If you have somebody that has been burned by water, boiling water, steam burns, those can continue to burn for 24 hours and continue to go through the skin. So that's how long it takes for that heat to come out. So just be careful when you're dressing burns like that. You want to be able to let them breathe. Don't put any Vaseline or anything over it for that first 24 hours because it traps the heat inside. Use the cool water, like I said. Cool cloths work really well, just dipping them in the cool water and placing it over top of the burn. And then another thing that you want to remember is if they've got a bad burn, you want to take off any rings or any other tight items around the burn area because it's going to swell. It's going to swell a lot and you're not going to be able to get any of the rings or anything off. So take those off immediately so that they don't get stuck. Remove any clothing if you need to. If the burn is underneath the clothing and you can't see it, take the clothing off so that you can see it and get the cool water on it. If they have any blisters, do not break the blisters. The blisters provide a barrier to keep this bacteria and everything out. If you break that blister, it's now open and things can get in, foreign bodies can get in. So if it has a blister, leave it alone and allow that to keep the infection out on its own. Once you've make sure that you get all the heat out of the burn, you can apply lotion or vitamin A and D ointment works really well on skin. The vitamins in it help with skin healing. You want to keep any open skin, any areas that the skin has been burnt off, you want to make sure you keep those moist. You can lose a lot of water through an open burn. People can get dehydrated really quickly on big ones. So you want to make sure to keep that moist. Make sure that they drink a lot of water, and make sure that they eat a lot of protein. Your body, whenever it's healing, that goes for wounds too, uses a ton of protein. So you may feel like you're completely overdoing it on giving them protein, but their body can really use it, especially if there's, trying to heal large areas. Once you kind of have that dressed, and you want to change the dressing about once a day, make sure you're keeping it super, super moist. And another note on burns is they're going to be very painful. Burns are one of the most painful things that can happen to somebody. And so you want to make sure that you are staying on top of the pain with whatever you've got on hand, ibuprofen, Tylenol. Hopefully if it's a big burn, you're able to get them to a hospital. And if they need to be in a burn unit type thing, then you can get them there. But in an emergency situation, if that doesn't happen, those are some things that you need to think about. Does anybody have any questions about burns or burn care? Okay, I will move on then.
Wait, Sam, I have a question.
Yes, go for it.
So burns on kids. So you said a burn can keep burning for up to 24 hours. But if you want your kid to like leave it alone, so you want to cover it, like at what point would you suggest doing that?
So what I would do is actually, it kind of depends on where it's at, but I would just take a cool cloth dipped in and wrap it in that to try to kind of keep their attention off of it. So it's wrapped, it's covered, it's staying moist, but you haven't done any of the dressing to kind of lock the heat in. Does that make sense?
Mm-hmm.
Yeah. I see a hand raised. Who's on the iPhone? Is it Janine?
Okay, so I heard a fireman gave this advice. He says the best thing that you can put on a 1st or 2nd degree burn is a whipped egg white, or just stirred with a fork. And he said that calms it down, it's cool, it's soothing, and it will leave no scars. Absolutely amazing.
It leaves no what?
Scarring.
Oh, okay. That's interesting. I hadn't heard the egg white thing, but.
Yeah. My sister put it to the test, and she said she had a nasty burn from the oven. She put her hand in to get something out, and it had a burn on her arm. She immediately took a fork and whipped up the egg white and plastered it on the burn. And she said it was completely healed in like 3 days and no scar.
Oh, that's cool.
So,
I hadn't heard of that one.
So give it a try. Well, hope you don't have to, but yeah, I'd heard it's like a miracle thing to put on burns. Anyway.
I do unfortunately have some experience with burns. Some of you know my son, Flint, he's 7 now, but I think it was 2 years ago now, he had an accident while we were camping down in Moab and sat in a pot of boiling water and had to be life flighted to the burn unit at the University of Utah. So had a little bit of experience with burns. It's traumatic. They are very painful. It's not any fun. So yeah. All right. So the next section I wanted to do was things that everybody should know, that we're not going to have time to cover, but would be awesome if everybody could either take a community class or an online class to just know these types of skills. CPR, you got to know CPR. There's a million classes for it. It does take a little bit of time to learn and get used to it, but definitely a good skill to have. The Heimlich maneuver to help people who are choking. Again, another must know skill. I think everybody should know it. Uses of over-the-counter medications. this is kind of goes back to my know what's in your first aid kit and know how to use them. You should have a whole bunch of different for over-the-counter medications, and you should know what they're for. So just be familiar with them so that when the need arises, you can use them. Basic first aid, burn care, wound care, just those types of things people should know. And then the other thing is shock treatment. And I will talk about shock treatment just a little bit. If you have somebody that's in shock, you can tell that they're in shock by their skin is going to feel cold and clammy. They're going to have a high pulse rate, and they're going to be breathing really fast, almost like hyperventilating. They're going to feel weak and fatigued. They could be dizzy or faint. And they may have changes to their mental state. They might be very confused about what's going on. And so if you see somebody that is displaying some of those things, the first thing that you need to do is have them lay down in a safe place and elevate their legs. The reason that you elevate their legs is because it helps blood return back to the main organs, to the brain, where if some of the things that make you go into is loss of blood, where your body's trying to overcompensate. And so if you put their legs up, the blood comes back to the areas that you need it the most. Keep them still and loosen any tight clothing and cover them with a blanket. A lot of times people who are going into shock will shiver and will be very cold because their body's working on things that are not keeping their body temperature. So cover them with a blanket, try to keep them as warm as you can. People can go into shock from dehydration. If they're in shock from dehydration and you know it, let them have some liquids slowly. If they're dehydrated enough to go into shock from dehydration, drinking a lot of liquids very quickly is going to make them sick, which will make it worse. So slowly on the fluids. If it's not from dehydration, do not let them eat or drink anything. You want to kind of let everything pass. They may be needing to go into surgery. Don't give them anything. And that's about all I've got to say on shock. If anybody has any questions.
Could I say something?
Yep.
Barbara Sharp. Anyway, when I was in my 20s, I was in a car accident. We were hit from behind, and then we hit a telephone pole head on, and I went unconscious. When I woke up, they had what is it called, the jaws of life there, and the car was surrounded with a lot of people. It was New Year's Eve, so I was out for quite a while. But what I remember of it was, number one, and I kept coming in and out of passing out, but I remember my date said that later he said that the first thing the police said, well, they couldn't get us out and they were trying to, was to cover me up, which you covered. And one thing you didn't mention was they kept saying over and over, make her talk, because she's in shock, and keep asking her questions and beg her to try to answer them. And so that was what I was going to suggest.
Yeah, that's another good one. Definitely trying to keep them alert, trying to talk them through it. One of the main things that you'll probably see in like a disaster situation is people going into shock, not necessarily because they're hurt, but just because their nerves and mental state is completely fried. Like they just can't cope with what's going on anymore. And so try to kind of talk them down, talk about something else, anything else, talk about the bees and the flowers and who knows, but anything that will keep them talking that's not the disaster is very helpful. Yes, thank you for that.
Can I ask you, why do you do that? Did you mention why?
Why keep them talking?
Right.
You just want to try to keep them conscious. As long as they're conscious, you know that they're okay to an extent. Once they pass out, you don't really know how they're doing anymore. Then you have to rely on things like what's their heart rate, what's their respiratory rate, like do they have a pulse anymore? But if they're talking to you, they do. So if you can keep them awake, that it can be very helpful in determining where you're at with the situation.
And my feeling was I was so out of it because I did keep passing out is that they were trying to keep me from going deeper into it. So anything that Ed could do to keep me from sinking deeper helped them how they tried to get the car open.
Yeah.
Does that make sense?
Yeah. So they didn't want you to go farther into the car. Gary, you have a question?
Yeah. Well, I just dealing with shock. I witnessed an auto pedestrian accident many years ago.
Mm-hmm.
And, you know, everybody's taking care of the person that was hurt in the accident. And all of a sudden, a couple of us realized the driver, this pregnant lady who had hit this girl, she was in bad shape.
Yeah.
And I mean, she was going into shock. So yeah, we got a blanket, we went over. So be aware of the people around as well.
For sure. And you can see people that look like they're fine. And then all of a sudden they're not, because like I said, they get to that point where their nerves were just fried and they can't handle the situation anymore. And that's when their body starts to go into shock to try to compensate with just being completely overstimulated with what's going on.
I mean, and this person wasn't physically injured at all, but the fact that she had hit this girl,
right?
I mean, she was freaking out and she needed people to help her as well. So
yeah, for sure. Another note that I just need to kind of plug in there because I didn't talk about it earlier. Anytime you're treating somebody for first aid, shock, anything, make sure that you check your surroundings before you kind of hunker down on a spot. You know, are there telephone poles? You know, what's going on around you? Make sure that it's an okay place, that you're not going to have to move them again for an extended period of time, that you're in a safe place that you can, you know, watch them and not worry about some of the other things that are going on. If anybody else doesn't have any questions about shock, I will move on to my last section real quick.
One question. What is the difference in the treatment of a blood blister and, as you have said, a water blister?
A blood blister can be tricky because sometimes you do want to drain blood blisters because if it's still bleeding, you want to relieve that pressure. Water blisters, you want to generally leave them alone if you can help it. You know, if you're hiking, you're probably going to pop your blister, but if you can avoid it, keep it intact. Blood blisters, if they're not painful, I would leave alone. If it's painful, you can go ahead and with a very clean instrument, drain it. And that will help with some of the pain of a blood blister. Okay, the last thing that I wanted to touch on a little bit was triaging after a community emergency. The definition of triage is to sort people into different categories. So in the event that we have a huge catastrophe that's going on, EMS is completely overwhelmed, we're not getting to a hospital for a long time, there is a system to determine who needs help the fastest within our neighborhoods. And the levels that have kind of been identified that most people generally use are black, red, yellow, and green. Black means that somebody is dead or dying and that there's not really a whole lot you're going to be able to do about it because they needed emergency care a while ago. Red is they need immediate care. They have life-threatening injuries that need attention right now. One of the things that we can do in our communities, if you have something like this, keep either streamers or construction paper or something that you can tape to your door that alerts people who are responding, who have medical training, to which houses they need to go to first. So they're going to go through the neighborhood and they're going to say, okay, that house has red on their door. We're going to go there first. So red gets treatment first. Red criteria is anybody that has a respiratory rate higher than 30. That means that they're in distress and they need to get attention right away. No palpable radial pulse. Radial pulse is the pulse on your wrist. And and this person is not able to follow any commands. They're probably unconscious or confused to the point where they're not making any sense. They're not following your instructions. That is somebody that would be categorized as red. Yellow criteria is somebody that is described as non-ambulatory. And that means that they're not going to walk anywhere by themselves. This person, the people that meet yellow criteria also should not have any of the things that would make them a red criteria. If they're unconscious, they're automatically red. But if they're awake, talking to you, but maybe have like a severe broken leg, they're not going anywhere, that would be a yellow. Green is somebody that would be able to walk themselves to a designated safe area and get themselves to some treatment. But maybe there's no treatment available. That would be a green criteria. And so those are kind of the categories to be aware of in a super disaster situation. People like myself will get our families safe and, grab our bags and walk the neighborhood and see who's got what on their door and try to hit them in that order. So that's just something to be aware of, something to be prepared for. In those situations, we're not probably going to get people to the hospital. We're probably not going to see EMS. They're going to be completely overwhelmed. That's like we're on our own situation. Does anybody have any questions about that?
Yes, I do.
Mm-hmm.
If you happen to come onto a scene where someone has been hurt, if there is blood coming from the mouth, how severe is it? And what should you do?
Super depends. If, because there could be blood coming from the mouth because they had a seizure and bit their tongue. So if that's the case, you just want to make sure you keep them safe, treat that. If it's more from like internal bleeding in a disaster situation, we're probably not going to save that person. It's going to be a little bit harsh making some of the decisions on a horrible day like that. If it's somebody like that you came across and it's a normal day and you can call 911, you just call 911 and get them there as soon as possible. There's probably not a whole lot you can do if it's an internal bleeding situation. Okay. Any other questions? Any other general questions about anything first aid medical?
I have a question.
Yeah.
So we haven't talked much about broken bones and how to splint, but would the broken bones be more like a yellow situation? I guess depending how ambulatory they are.
Yeah, it would kind of depend on where it is. If it's an arm, then they're going to be green. If it's a foot or a leg, that would be a yellow.
Okay.
Yeah.
Okay.
Because I Googled the egg white for burns, and it's page after page saying, do not do it.
Oh.
Well, first off, eggs, you may be introducing salmonella.
Yeah.
And egg whites are a medium for growing bacteria.
Good to know.
I mean, it's apparently a widespread thing that people do it. But yeah, all the warnings were saying, please don't do it. I hate to contradict somebody, but I thought I'd Google it and see what it said.
Okay.
I took this CERT training years ago, and I don't remember a lot, but my next door neighbor's in a wheelchair, and so I do remember one thing. And if somebody's injured, they were showing us how to use a blanket to roll a body onto a blanket, and then you can ease them off the bed and do all kinds of things to help somebody who's injured. If you don't have the strength, like to pick them up or something like that. So do you have any comments on telling us how to do something like that and when we should do it?
Yeah, so that's part of the reason I keep my sheet. Is if I've got somebody in an area where I don't want them to be in and I can't do first aid safely, I will lay out my sheet, roll them onto it, and then I can drag them wherever I need to get them to. The best way to do it is to lay your sheet out. I wish we could like be in a gym and I could kind of demonstrate it, but if you lay it all the way out and fold it, kind of scrunch it up, half of it. Then you can kind of lift them up halfway, push it under, lay them down on it, lift up their other side, and pull the other side straight, and then lay them down flat on it. So you don't have to actually lift them all the way up or roll them over and over. You can just lift up one side, tuck it under, lift up the other side, pull it out, and then they're on it. And you can move them that way. Yeah, great comment. So we're about out of time. One last thing I did want to say is about tourniquets. People like to talk about tourniquets a lot in disaster situations, but most people don't know how to use them or when to use them. So it can be a little bit difficult to tell when to use a tourniquet. A tourniquet is used either on an arm or a leg to stop severe bleeding. And we're talking like life-threatening bleeding, because if you use a tourniquet on somebody and it's not like a last-ditch effort to keep them from bleeding out, they're going to lose the arm or the leg. Pretty much, if you're going to use a tourniquet and you can't get them to medical care like right now, you are cutting off all the blood flow to that limb. So they're going to lose the arm or the leg. So if they're bleeding that much that they really need it, of course, use a tourniquet. But first, you definitely want to try to just put pressure on it. One thing that I think people kind of overreact about with large wounds is there is a lot of blood. But sometimes it looks like a lot more blood than it really is. So just make sure that you are like 100% sure that you have to use the tourniquet to save their life, because it may be a lot of blood, but it may not be life-threatening amount of blood, if that makes sense. And just if you are going to carry a tourniquet and be prepared to use it, just make sure you know exactly how to use it. You don't want to just kind of tighten it down. You want to make sure that you tighten it all the way down and there's no more blood going to the wound. Like it should immediately stop bleeding. So little bit about that. Don't put a tourniquet on somebody that's just kind of sort of bleeding, because we don't want people to lose arms or legs because they had a okay sized cut, but wasn't enough to need one. And I think that's about all I've got. Anybody have any last minute questions before we close for today?
Thanks so much, Samantha.
Yeah, hopefully I can cover people's questions about it. And obviously we can't go over every first aid thing in an hour, but we do our best.
That was great.
I just wanted to put a plug in for Murray Fire. They're going to be starting up first aid classes, and Brad, correct me if I'm wrong. I think they're like every Monday, or are they once a month? Do you remember how what George said? When we
they're on Tuesday evenings.
Oh, okay. But we could we'll send out on the Facebook page once they start their classes. They're free, and they do a wonderful job. They're at the new Murray, not our fire department down on Vine. They're over on 4800 South. They hold the classes there, and they will be starting CERT training too. And we will, when that happens, we'll be sending out a sign-up sheet for any of you that haven't been CERT trained.
Okay, I guess that's me again.
What CERT training is?
CERT training is Community Emergency Response Team. And it's basically to train you in an event of a big emergency. You know, the fire department will tell you we're going to be on our own for a week to 2 weeks, if not longer. So we're going to have to take care of each other. And it's CERT training. They go through medical, they go through first aid, they go through, you know, how to rescue someone out from underneath a large object, searching structures, just everything you could ever think about in a natural disaster. I highly recommend taking it. It's free. So,
Brad?
Yes.
Do they include in those classes CPR and also the use of what is it, the Heimlich maneuver?
They do. They do. That's part of the medical that they do in it. Yeah. So it's kind of a basic crash course on everything. So do we have any other questions last minute here or anything? Anybody?
Yes, Faye, go ahead.
Where did you get that kit thing to put your first aid stuff in, that plastic thing?
This big box?
Yeah.
I got it at Home Depot, but they have them at most hardware stores. This brand happens to be an HDX box, but I know that other brands make them. And it's just
for tools or fishing, or
it's
something.
a toolbox. It's a toolbox, and it has dividers that you can move around to wherever you want them to fit your supplies.
I like the handle thing for it.
Yeah, so I like the handle, and I like that it's double-sided because it gives me lots of storage, and I love lots of storage because I like to keep all the things.
Thank you.
Yep.
Now I'll tell you a quick burn thing. My brother-in-law was camping, and his little girl tripped and fell. And when she landed, her face hit the kerosene lamp that was on. Wow. And it took skin off her face somewhere. And he grabbed her and shoved her face in the ice chest. And she never had a scar.
That's amazing.
Yeah.
Yeah, the faster you can cool the burn, the less damage there will be.
Yeah.
Okay, back to it. Just a quick announcement. Next month, we are going to do food storage. It's going to be our training. And also, we'd like to thank Samantha. Thank you very, very much for doing our training tonight. I'm going to stop the recording really quick, and then I'll